Hi, my name is Sanjay Agrawal and I'm a consultant in respiratory and intensive care medicine at the University Hospitals of Leicester. And my link to the academy is through the mentoring program. So my personal reflections of the COVID pandemic in the intensive care unit are that patients are really sick, not surprisingly. They are much younger than our normal cohort of patients. And unfortunately, the disease can be relatively unpredictable and unforgiving. And so this has been a real challenge to me as an intensivist, trying to help them get better. The other challenge, I think, in the intensive care unit is obviously working in an entirely different way, wearing full personal protective equipment, which becomes very hot and difficult to communicate. And it's also made it very difficult with respect to the way how we place patients in different bays. Finally, it's really hard on relatives because they can't come and visit their loved ones. So I found doing these shifts over the last couple of months. I'm working nights for the first time in almost a quarter of a century, which has been a shock to my system, and I've needed to decompress after my ITU shifts and stints. I would say that firstly, just reflecting on the fact that I need to decompress. I've never normally need to think about it in an active way. It's always been fairly passive. So reflecting on what's happening, why I feel the way I do, has become something I've not really had to do before, but is important. So I talk to colleagues because if I'm feeling down, for instance, or struggling to work something out, I know my colleagues must be too, and it's been really helpful talking things through, and people have been really open about talking. The next thing I would say is making sure that I switch off, and so there are millions of WhatsApp groups now of different clinicians, different people, and it can be really helpful and supportive when you want to communicate, but equally I found that it's almost more important to switch off and not look at the things, some of these things. Finally, I would say that I've embraced the things that I enjoy in my everyday life. So we've got a 1-year-old dog. Walking the dog, playing with a puppy is fantastic. Listening to music, me and a friend send each other a song or a music video clip each day, and that's been really helpful to think about something differently. And I exercise as well, and doing that regularly has helped me de-stress and decompress. So I hope some of these things might be helpful for you too.